Hi winners, this is Dr. Srikanth from team MDS CONQUER. Now in this video, we'll be discussing about our 50 days plan of action of boot camp of MPPSC. Okay, so dates are clear. Schedule was already discussed. Now I'm giving a clear-cut schedule with few add-ons, which are very, very important to be done in the next 50 days. So a brief glance, we have splitted the entire schedule into 4 parts, 4 modules, and each module is going to carry important subjects. Okay, and after each module we'll be having one exam, followed by we'll be having a combination of module wise exam, and followed by we'll be having mock exams. Total we'll be having 10 exams, each of 100 MCQs, focusing only on the dental part. Okay, I hope this is very, very clear. So in a simple sense, I want you to split your day into 3 parts. Okay, because this is a 150 mark examination. So I want you to split your day into 3 parts. Okay, and give 2 parts to this 100 marks dental exam and 1 part to your general knowledge. Okay, right? So split your day. Like for example, if you're reading for around 9 hours, split the day into 3 parts, like 3. 6 hours you give to dental part and 3 hours you can give to the general part. So make sure I want you to spend at least like 6 plus or 9 plus hours per day for the last 50 days to get a decent rank or to fall into the particular criteria for your job. Okay, so as already discussed, the first module is going to be the Captain America module, where we will be having dental materials for 2 days, operative dentistry, which will be run for 2 days, endo for 2 days, pedo for 2 days, and prosto for 3 days. That is 27, 28, and 29. And 29th, I want you to take examination, or 30th you can take exam and you can start the next module proceedings. And all the subjects which are included in this particular module are integrated subjects. They are integrated to each other. Okay, means if you read these subjects as a combination, the advantage is most of the topics are common to each other. For example, you see dental materials is going to have topics like amalgam, direct filling gold, composites, cements. All these are common topics for operative dentistry also. Similarly, topics of operative dentistry and endo will fall under pedo. Like you see direct pulp cappings, pulp appings, pulpotomies, apexifications, apexogenesis, pediatric endodontics, all these are part of pedo again. And you take your operative dentistry part, there are many topics which are common for both pedo as well as operative. Again, prosto is inclined to dental materials. Okay, so that is the reason why. So I kept all this together so that the reading will be very, very easy. And I'll be giving you a rough checklist also, what to be done and everything on the group. Okay, on the group, not here, on the group. What is the mandatory thing to be done? What is the source that you have to do? I'll be dropping the voice note on the group, so which you can use it. Okay, so 29th, you will be having exam. You will be having your first exam. So 29th, you'll be having your first examination. Make sure I want you to finish this exam either on 29th or either on 30th. And 30th, you're going to start community. So you'll be having community for 2 days. Okay, again, community parts are integrated to the previous module part, means the few topics which are integrated to operative, which are integrated to pedo. Radiology is a minor subject which has to be done in 1 day. Perio for 2 days and ortho for 2 days. Okay, and biochemistry for 1 day, less than 1 day. Okay, less than 1 day. And I'll clearly mention what are the topics to be done in biochem. Biochem, I want you guys to finish dental pulse synopsis part, the few corrections in that which I'll be mentioning on the group. So corrections has to be done along with that. And the most important part in this synopsis is vitamins. Vitamins is very, very important for this examination. Vitamins plus carbohydrates. Vitamins and carbohydrates are very important. Entire synopsis part has to be done, but the more focus should be on vitamins. Okay, your 50% of biochem focus should be on the vitamins. Completely, I want you to do the vitamins part. Solve the MCQs also present on the vitamins. Very important. Okay, right? So on 8th, we'll be having the second examination, which is exclusively on the Spider-Man module. Okay, then coming to the third module. Third module is an Iron Man module, where you will be having 8, 9, 10, 3 days for anatomy, 12, 13, 14 for oral surgery. That is, I have given 3 days for oral surgery, and followed by the topics to be focused more in general surgery, which I'll be sharing onto the group. So I want you to focus more on burns, thyroid swellings, head and neck tumors, and few other miscellaneous part, ulcers and ulcers has to be done. That I'll be giving you what to be done and everything I'll be giving you. Okay, right? So I'll be giving you. You can focus on doing that. More than sufficient. Then I have given 2 days for 2 days for anatomy, which is more according to me. I want you to focus on dental pulse synopsis part completely, solidly, do it thoroughly. Okay. And I have given 1 day for dental histology, again dental pulse synopsis with MCQs. Okay. Stick on to dental pulse synopsis for these minor topics like biochemistry, dental anatomy, dental histology, dental materials. I want you to stick on to the dental pulse synopsis, more than sufficient in this limited time. Coming to the next subject. Okay, I told you to ignore general medicine part. Maybe dental considerations I'll be giving you where to be done. Okay, dental consideration. Only thing to be done in general medicine is dental considerations and medical emergencies. Rest everything you can ignore. So that you are having 19, 20, 21 for your oral path and oral medicine exclusively. Okay. Solve many questions, do dental pulse synopsis. Okay. Again, general path, I want you to do the basics part like necrosis, apoptosis, calcifications, a little bit about genetics, which I'll be telling you what to be done. Source, I'll be telling you what to be done. Micro, some very common basics of micro, maybe a little bit about gram staining, sterilization, TB, syphilis, leprosy, AIDS, hepatitis, herpes, candidiasis, mucormycosis, tinea solium, malaria, and amoeba. More than sufficient. Okay. If you want, you can add ocularia branchiorrhea also. Okay. More than sufficient. Just stick on to these things. Okay. Right. Again, pharmacology for 2 days. I want you to stick on more to chemotherapy. General anesthesia, local anesthesia, chemotherapy, and NSAIDs. Little bit about other basics, other systems. Sufficient basics you can do. Just to know the names of the drugs, they fall under which classification. Such a basics has to be done. For this, the best source is going to be your dental pulse synopsis. Physiology, again, stick on to only dental pulse synopsis. Okay, right. So this is the rough outline. So on 26th, what we are going to do is we are going to have an exam on this Hulk module. Okay, we are going to have an exam on the Hulk module. Okay, guys, I hope you are very, very clear. So I'm just recapping. So Captain America, we are going to have the first exam on 29th, and followed by Spider-Man module, we are going to have exam on 8th September. And coming to the Iron Man module, we are going to have exam on 18th September. And next comes is 26th September, we are going to exam on Hulk module. So Hulk module is the recent module that you are done on 26th. So 27, 28 is going to be revision. On 20th, we are going to have an exam on the Hulk module, which is a recent module, and the Captain America, that is the first module. We are going to have one more exam. So this is going to be our 5th exam. 29 and 30, you're going to have revision of your Spider-Man and Iron Man. Okay, that is your 2nd and 3rd modules, and you're going to have an exam. So this is a 6th exam. First revision, 2nd revision, you're going to have an exam, that is mock first, 7th exam. 3rd and 4th, you're going to have a mock 2, that is your 8th exam. 5 and 6, mock 3, 9th exam. And 7, 8, mock 4, 10th exam. So total we are going to have 10 exams, and further you're going to do revision, and you're going to have your D-Day. So this is the exact dates and how we are going to approach and everything. Okay, so I want you to stick on to the basic plan. I know that a few of you have done lots of content related to many subjects and many topics. stick on to that content. Stick on to that content. Like you're done with endo, you have done something, do that. Try to finish it. Like I have given 2 days for endo now. Okay. But if you feel like your revision can be done in 1 day, chalo, close the endo for 1 day. Okay. Whatever exams you have, whatever access you have, you try to finish it off. Whatever that is available on the website for you. Use that extra day for a subject which you are weak at. Use that extra day for the subject which you have not done. Use that extra day for the subject which you are not confident. So I'll be sharing this PDF, okay, to you guys on the respected groups for the registered students. And for non-registered students also, I recommend this. I told you, split the day into 3 parts. 1 part I want you to use for GK. The leftover 2 parts I want you to for the dental. And this is the best segregation of schedule according to me. Okay, if you want the PDF, I'll be sharing the PDF. Take the printout of the PDF. Then you do the necessary modifications. For example, you're done with pedo very recently. You no need to spend 2 days for the pedo. Maybe you take little time to do the backlogs of pedo, close it for half a day, so that 1.5 day extra day can be useful for other subjects. So you do the necessary modifications basing upon your pattern of reading. For example, you're already a person who's done PG from a particular department. For example, I am preparing for MPPSC and I am PG from endo. So my endo is done. So because I'm good at endo, so if I want to revise some classifications, I'm going to revise. But mostly I feel like I can handle endo questions. So that 2 days can be saved. Operative, yes, operative is also done for me, 2 days saved. DM, a part of DM is also okay for me. So I'll read prosthetic DM rather than reading the operative and endo inclined DM. So I'm a PG in a particular department. Yes, you can ignore your department stuff a little because you are familiar to answer those basic questions. Because in this exam, most of the questions will move around the basics. They don't go for a depth oriented questions, or they don't go for an article based questions, or they don't go for an advanced dentistry based questions. Pakka 100% sure they won't give. Okay, they will move around the basics. And you are doing a PG in a particular department, first year PG or second year PG, done with PG. I hope basic questions you guys can answer from your department. So that is going to reduce your burden on that particular department, and that extra time you can use for other subjects which you are weak at, or other subjects which you are not confident at. Okay, such as subjects where you need to rely exclusively on the Dental Pulse synopsis, because that is an accessible book for most of us, is one is DM. Chalo, you can use operative synopsis also in dental materials, decently good, very sufficient. Then you can do endo also. A little bit corrections are there. You can do endo also. Pedo, yeah, it's not sufficient. Prostho, yeah, thumbs up. Prostho is sufficient, nice. Community, no, not sufficient. You have to do from a different source. People who has access to Power Play books, you can do from PP books. Oral radiology, yes, sufficient. Perio, no, not sufficient. Ortho, not sufficient. Biochemistry can be done good. General anatomy can be done good. OS is too vast, but it is good. Oral surgery, not required. Dental anatomy, yes, you can do it. Oral histology, you can do it. Oral path and oral medicine, you can do it. But my recommendation for oral path and oral medicine is, rather than reading oral path and oral medicine, Dental Pulse synopsis at a stretch, it's going to be so difficult, so volatile. I recommend every day 1 pace of oral path and oral medicine on a daily basis. You can give 10 minutes or 15 minutes every day. Oral path. Start your day with oral path and oral medicine synopsis. My recommendation: read 1 pace or read half pace. 15-20 minutes, you start your day, read half pace or read 1 page, it's okay. But reading at a stretch continuously for those 25 to 30 pages in the 4th module, it's going to be so volatile. It's going to be so difficult for you. Things will get overlapped, contents will get overlapped, because most of these things are memory based things which you are revising. So general path synopsis is okay. Micro is again a volatile thing. Better try to focus on these areas I'll be giving you. Pharmacology can be done. Yes, physiology can be done. Okay, right? So I hope this is right. And apart from this, on the daily basis, on the group, I'll be discussing all your MPPSC previous exam papers. Each and every question will be discussing. I hope we have given access to all the papers. 2 or 3 are left over, which we will be activating in the next 1 or 2 days. I myself will discuss all those last 5 years accessible MPPSC which are available not on social media, because our content is very huge, which I'm collecting the info from last 20-25 years. So I have access to some 5 or 6 years of old MPPSC, which we will be discussing exclusively on our MPPSC WhatsApp group. Okay, right, clear? I hope this is clear. If you have any doubts, You can drop in the comment box. That will try to help you out. The team will try to address you and help you out. And yeah, we will try to do our best in the last 50 days. And hopefully the exam should be and will be on time, because all the hard work, whatever we have done, whatever we are doing, whatever we are going to do, should get appreciated only if the exam is conducted on time by MP people. Okay, right? So all the best. Take care. Study well. See you very, very soon on our WhatsApp groups. And the free Telegram group link will be posted in this link. And if possible, we will be having few live interactive sessions for the next upcoming few days, focusing only on MPPSC students. So I want you to subscribe to our YouTube channel, one, because where we are going to take multiple live interactions. Okay, and Instagram channel page, I want you guys to follow, because we'll be giving all the updates and live sessions on that area. We'll be having few rapid fires in the YouTube live as well as in the Instagram live. And of course, we'll be having alternative day, some sort of discussion or some sort of content exchange, which is very, very important for exam, on the Telegram group. All the links of these three, that is YouTube, Instagram, as well as the free MDSConquer Telegram group links, will be shared below in the description part. And please don't hesitate to be a part of that particular group to gain that extra knowledge. Thank you. See you. Bye bye.